When Uganda declared an Ebola outbreak, several countries issued travel advisories and restrictions affecting travelers from Uganda and neighboring countries. The U.S. Embassy in Uganda suspended visa services, while the U.S. government later announced that all non-citizens who had traveled to Uganda, the Democratic Republic of Congo or South Sudan within the previous 21 days would not be allowed entry into the United States. The Center for Disease Control and Prevention later extended the restrictions to green card holders who had recently traveled to the affected countries. Canada and the Bahamas also announced temporary travel restrictions targeting travelers from Uganda, the DRC and South Sudan. These advisories are already affecting Uganda's tourism and business sectors, with tour operators reporting cancellations from travelers who had planned to visit the country.
We've registered a number of cancellations from some markets, such as the US, that have gone ahead to put a travel ban. They elevated us at level 4, which says it's no travel to Uganda. Such advisories heavily affect our business here. They cause a lot of cancellations, and indeed it is felt in our tourism circles.
But hotels have already registered. They have lost bookings now in the billions of shillings from outside conferences. And it's truly, truly sad for us because, as you know, we've been on an upward trajectory. We've just hosted a very successful Pearl of Africa Expo. We have been bidding for more conferences and events. Arsenal acknowledging Uganda because of the celebrations that we had. People have been making all these inquiries about Uganda and wanting to come to Uganda. What is it about Uganda, both from the sports angle, from celebrities like Steve Harvey, and all the work that we have been doing in the past, and all of that is quickly dissipating because of this news about Ebola.
According to the Uganda Tourism Board, some tourists had booked and paid for trips months and even years in advance, with tour operators already investing in accommodation, transport and logistics. Stakeholders warn that the cancellations could lead to financial losses because much of the money had already been committed.
So the damage will be felt not only in gorilla tracking, but overall numbers of tourists coming in the country, because even the person who is in Padel, one in Mbale, wherever outside Kampala, will feel the impact of that visitor not coming.
Ugandans planning to travel abroad are also facing challenges, with some reportedly denied entry, while others are subjected to mandatory quarantine requirements that many describe as impractical for short business or leisure trips.
A big group of people who were supposed to go to the UK for a big conferences, and all their visas have been cancelled because of that.
Despite the growing concerns, tourism stakeholders insist Uganda remains safe for visitors and tourists. They say that Uganda is unfairly being viewed in the same light as the Democratic Republic of Congo, which has recorded a larger outbreak, yet Uganda's situation remains under control.
I think it's because they called it the Bundibujo virus, so when everybody Googles Bundibujo, they say Uganda. So we are taking a greater hit, in my opinion. I don't know whether this is for everybody else, but in my opinion, we are taking a much greater hit than DRC, because Rwanda is close to DRC. You don't see any of this being talked about Rwanda, but Uganda is taking a very big hit because of the naming of the virus.
It's imperative for people to know that Uganda is actually safe. We are safe, we are open and welcoming to every traveler coming to this country.
Uganda has so far recorded 7 cumulative Ebola cases, including 1 death. The number of contacts linked to the confirmed cases has continued to rise, with many of them being health workers. While appearing on the BBC yesterday, Permanent Secretary in the Ministry of Health, Dr. Diana Atwine, said that Uganda has also been approached about the possibility of setting up an Ebola quarantine to handle American citizens. She said Uganda was open to discussions on the matter. This comes at a time when some health facilities in Kampala have restricted access following suspected Ebola exposure. Our team visited one of the facilities after reports emerged that some Ebola cases had been linked to the hospital. Posing as patients seeking treatment, our reporters were denied entry. Staff at the gate said the facility had undergone fumigation on Wednesday and again today. Officials from the Ministry of Health were also seen entering the premises during our visit. Ebola is a severe and often fatal disease that spreads through direct contact with body fluids of an infected person, including blood, saliva, sweat, urine, vomit, and contaminated materials such as clothing and medical equipment. Health experts advise the public to avoid physical contact with anyone showing Ebola symptoms, maintain proper hand hygiene, seek immediate medical attention if symptoms appear. Some of the common symptoms include high fever, fatigue, chest pain, diarrhea, vomiting, and unexplained bleeding. Nobat Atkunda, NTV News.